Hello, future doctors. Welcome back to MedSteps ECG Series by Dr. Anand. So, in day 8, we learned how to calculate heart rate using the 300 method with large boxes, so which is useful for regular rhythm. But what if the rhythm is irregular? Can we still use the 300 method? The answer is no. So, today we will learn how to calculate the heart rate in irregular rhythms using the 6-second method and understanding the importance of the RR interval. Okay, so what is the RR interval? So you can see here the RR interval is the distance between one R wave and the next R wave. So you can see here this is one R wave and this is the next R wave. This is the distance between the R wave. So here you can see the R wave is the tallest spike in the QRS complex. So this R wave, the next R wave we called RR interval. Okay. So what does RR interval tell us? The RR interval tells us whether the rhythm is regular or irregular. So that's why we have to always compare this R wave, the tall spikes. Okay, so in regular rhythm, we can see if every RR interval is the same, the rhythm will be is regular. Okay, if RR, we can see four large boxes, and for example, you can see R to R four large boxes. So that is regular rhythm. In irregular rhythm, you can see if the R wave will be like tall, like more wide and less. If you're seeing like for example the rhythm is irregular, along with that like RR interval will be like three large boxes or sometimes five large boxes or four large boxes or two large boxes, that will be like irregular rhythm. Okay, why can't we use this 300 method? Means the 300 method the 300 method assumes that every heartbeat occurs at equal intervals. In irregular rhythms, the distance between R waves constantly changes. So therefore, 300 divided by large boxes is not accurate. So that's why we have to check with 6 seconds R waves method. Okay. So the 6-second method, what it is. So for irregular rhythms, use the 6-second method. The steps will be like find a 6-second ECG strip, and we have to count the number of QRS complex and we have to multiply by 10. So we have to count that 6 seconds QRS complex and we have to multiply by 10. Why multiply by 10 means because the 6 seconds into 10 equal to 60 seconds. Okay, so for example, you can see here in example 1, you can see this is the ECG strip. In the ECG strip, you can see here that 8 QRS complex. 1, 2, 3, 4, 5, 6, 7. Okay, so it's maybe picture problem. So 8 QRS, 7 QRS complex you can see here. So in this 7 QRS complex, if you're seeing here the 7 into 10, so the heart rate will be like 70 beats per minute. Okay, because of 7 QRS complex. Okay, in 6 seconds. So like that you can count. Next you can see another example. Here you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay, because of while generating picture it came mistake. So if you're saying here you can see 11 QRS complexes. So if 11 QRS complexes into 10, so that heartbeat will be like 110 beats per minute. Okay, in examples 3 you can see here that is 4 QRS complex. Since 4 QRS complex you can see here that is in 6 seconds. So the heart rate will be like 4 into 10, it will be like 40 beats per minute. So in step 5 you can see here which rhythms use the 6-second method. So if these are the methods we will use in okay, this 6-second method we will use in atrial fibrillation, frequent premature beats, and multifocal atrial tachycardia and any irregular rhythms are there means we are going to use. Okay, so now this RR interval in common rhythms, how we can see. So normal sinus rhythm means RR interval are equal and rhythm will be like regular. So in sinus arrhythmia, we can say like RR interval change slightly with breathing and the rhythm will be like slightly irregular. Okay, so you can see the distance between this one and this one. So slightly irregular. So next you can see here that is atrial fibrillation. The RR interval are completely unpredictable. This is called irregular, regular, irregularly irregular rhythm. Okay, some RR interval will be like less or it will increase. So whenever patient getting this type of irregularly irregular rhythm, we have to suspect patient have atrial fibrillation. So in clinical correlation, a patient presents with palpitations, ECG shows no visible P waves and irregular RR intervals. The heart rate estimated by 6-second method and you can see 100 beats per minute. So the diagnosis will be like atrial fibrillation. Okay, so this is the ECG. You can see this type of ECG in atrial fibrillation. So one is regular rhythm you can see. Okay, so this is ECG rhythm. So next you can see here regular versus irregular. So in regular versus irregular rhythm, you can see here the RR interval will be like in regular rhythm it will be like equal. In irregular rhythm it will be like unequal. Okay, and the 300 method will be like regular rhythm will be like we can use, and in irregular rhythm we can't use. The 6-second method we can use in regular rhythm, that it will be like optional, but irregular rhythm will be like best choice. Okay, so next we can see here that quick ECG reading approach. How to interpret that ECG fast means whenever you receive an ECG, first step one, we have to look at the RR intervals. Then after we have to ask yourself, are all RR interval equals or not? If yes, we can go with 300 method, regular rhythm. If no, then you have to go with the 6-second method for irregular rhythms. In FMGE or NEET PG in USMLE or clinical rotations or cardio end of the cardiology department, if you are doing any OSCE or examination, this is exam point of view, this is very important. RR interval distance between two consecutive R waves. Equal RR interval means it's like regular rhythm. Unequal RR interval means it's irregular rhythm. Heart rate is irregular rhythm. Count QRS complexes in 6 seconds and we have to multiply by 10. So the atrial fibrillation always we have to tell irregular rhythm. Okay, so these are the things. So in regular rhythm we have to follow 300 method. In irregular rhythm we have to follow count QRS complexes in 6 seconds for 10 with the 10 we have to multiply by 10. So excellent. So today we learn how to recognize regular and irregular rhythms using the RR interval and how to calculate heart rate accurately in irregular rhythms. So in day 10 we will learn about cardiac axis deviation, including the normal axis, left axis deviation and right axis deviation, and a simple shortcut to identify the axis on an ECG. So see you in next ECG lessons on med steps by Dr. Anand. So till the time, take care. Bye bye.